So here's the agenda. We are very pleased to have Anna Hartley, our Director of Public Health, who's going to give you our local COVID update. And we're delighted to have back with us Dr. Colin Spears, Clinical Lead for the vaccines. And then we're going to talk a little bit about the future of the COVID community champions, and there's going to be plenty of opportunity for you to ask questions. So over to you, Anna.
Brilliant. Great. So first, welcome everybody. Thank you so much for coming today. And we're really delighted that we've got Dr. Colin Spears, who's a local GP clinical director, but is also the GP leading on the vaccination campaign, who's here to talk to us today as well. So it's really great to have him. So I'm just going to do my normal whiz through the data, but I am going to focus a bit on the Indian variant today, because I think that is something that is concerning sort of local residents. So we'll talk about that as well. So again, just the classic slides that I always show you. And again, you can see that we are still, our numbers are still reducing, which is great. They've kind of stabilised around about sort of 34 per 100,000, but have been fairly stable for a week or so now. And that just puts us, well, if you just show me the next slide, actually, Trace, I think it gives a bit more of the context. And you can see that our case rate in the over 60s is still really low, so that's fantastic. Positivity rate very low as well, that's very good. If you look at our neighbours though, you'll see that Kirklees, that's actually out of date now. Kirklees case rate is now over 100 per 100,000, and that is in part due to increasing cases of the Indian variant, which again I will talk about a little bit later on the slides. But generally we are now sort of a bit below the West Yorkshire average and not far off the England average, so much better than we were doing previously. So again, just to show you our testing rates by age group, and again, no surprise that it's our 11 to 16 year olds that are showing those higher testing rates. That's reflecting both the fact that that is really reflecting the fact that they're doing lots of lateral flow tests, which mean that they end up doing PCR tests if they get a positive, but also we are seeing the highest infection rates in that age group still, which isn't really surprising given that we've had such a successful vaccination campaign. So a lot of the older people have had the one or two vaccinations now, so that would protect us from the virus. And again, you can see that this slide is looking really excellent around that 80 plus age group, really low numbers. And again, that, you know, for any vaccination doubters out there, that's such good evidence that from the moment we started vaccinating those cohorts, those numbers have gone right down. And you can see we've got those higher numbers in that sort of 11 to 16 age group. And if you think about that cohort of young people, schools are doing a fantastic job still at sort of putting in measures at school, but obviously they're out and about, they're meeting friends, they've got great social lives. As the restrictions have been lifted, you know, it makes complete sense that we've seen those infection rates rise in that group. And what's really brilliant is that we know for children and young people, they don't have that it is a mild self-limiting virus. There don't seem to be significant consequences. So whilst we would still obviously be asking people to take tests, to self-isolate, to be cautious, I think we don't need to be fearful either. And I think it is, as you can see, those numbers have come right down in that age group, and we'll wait and see what happens over the next few weeks. And again, just a quick snapshot of the district. You can see again all of those white areas are areas where the numbers are so low we can't actually share them. So again, nothing too worrying. You can see with the Kirklees context, those large red sort of circles, you can see where those numbers in Kirklees are much higher. And that's obviously why Kirklees has then become this area of concern nationally, along with, I think it's just a number of other areas in Lancashire. So that's quite challenging for our sort of Kirklees residents and our partners in Kirklees. And again, if you look at that context, that's Kirklees, you can see those really high rates in that 11 to 16, sort of 17 to 18 age range. And I think what probably, again, you know, that is an age range that tends to mix more, have more social contacts, etc. So that's why you see that increased risk of infection. So again, we always try and show you the sort of the recorded exposure events, and this is where when somebody becomes a positive case, they get that phone call from Test and Trace, and they just ask them about their what they've done in the last two to 7 days before becoming infected. And you'll know because of what I've said before, it used to be extremely high in workplaces, so it's still quite a high percentage of the infections, but because our rates have gone down such a lot, that you can see those much smaller bubbles on the right hand side, just demonstrating really that we're having much lower rates, but workplaces still remain a kind of key risk area for us in terms of infection exposure. So, but again, another good news story here. I show you these every time they get lower, and that's, it's so low we can almost not see those numbers about admission. So that's really, really positive, and we need to sort of hold on to that. And again, with COVID deaths, we're sort of seeing either none or one at the moment. So again, that's really heartening, and again, testament to everyone's hard work, including the work of the community champions about getting those messages out there, and that the way that we've been able to really increase that vaccination rate. So I just want to talk a bit about variants of concern. And we haven't come so far, we haven't done all we've done for a year and a half to start to not have a really sensible attitude towards new variants of concern. So viruses mutate. Colin's going to talk a bit about it in more general terms. I'll talk a bit about the Indian variant, but just to give you a bit of context, and I wrote all this down, at the moment we've got 5 variants of concern in the country. We've got 8 variants under investigation. We've got another 13 variants that are being monitored. And actually, that's just how it is with viruses. They mutate, that's how it is. So what happens is, obviously with COVID, it's of concern. So PHE are keeping an eye on some of that. On this, but what this diagram I thought showed quite nicely was all of those variants a number of the variants of concern that are being observed, and you can see along the left-hand line is how many cumulative cases you've got. And that first line, that one that's gone right up really high, that is the Indian variant. And actually, it's not that much more infectious, we don't think. But I think that what we did have was people coming back from the Indian subcontinent initially, potentially going into houses of quite a lot of people, and just potentially that meaning that you've got that household spread. So you saw those numbers going up. Actually, the Kent variant, which originated in Kent and has now gone right across the whole world, was actually 8% more infectious than the previous variant, whereas the Indian variant is only 4% more infectious than that. So actually the Kent variant, which happened sort of December time, is actually in many ways was much more of a concern, but we just nobody seemed particularly bothered about that one. And certainly the Kent variant had a big impact in Wakefield in January time, where we saw those really high numbers, and we saw that enduring transmission. And you can see from some of those, some of the variants of concern, so that lighter coloured line across the bottom, you basically get a rise in cases and it just flattens out and it just kind of goes away. So, all the time we've got all these scientists observing all of these things that are happening. Sometimes it just ends up in nothing. Sometimes it becomes more concerning, but it's the constant background really to what happens around infection control. So there's PHE have written a paper which is really helpful, and I've put the link to that at the bottom, and you can just go on and have a look if you're so inclined. And if you're not so inclined, you can just look at my bullet points, which will tell you some of the key things. So they looked at 2,889 cases of the Indian variant, and the case fatality rate, so of the number of people there that actually died, was less than was 0.2%, so less than 0.5%. So actually, I think for the Kent variant, it was a 3% case fatality rate. So again, not concerning around the case fatality rate. Obviously, we now have most people vaccinated who are in that high risk category, so it is a little bit difficult to compare in that sense, but not something that's particularly concerning. The A&E visits were 3.6% of cases visited A&E, and only 1.1% had an overnight stay. It is more infectious, there is no doubt about it, and from the very early data, so that's quite small numbers, the Kent variant was, as I said, 8% more infectious than the previous variant, and the Indian variant, it looks like it's 4% more infectious than the Kent variant. So that is a worry. And I think for me, the bit that bothers me most is around particularly children. So we're seeing kind of school outbreaks where we're getting more people become positive. And it's just, you know, our children have been through enough, haven't they, the last year and a bit, being missed so much school. The last thing we want is more children missing school. My daughter, she's just brought me a cup of tea. My own daughter has just been sent home for 10 days, which means we can't go on holiday to Cornwall when we were supposed to be going on Sunday to see my mum and dad, who we haven't seen since August. Not that I'm bitter, but I think, you know, for all of us, even me and my job, it has a massive impact on families, the ability to kind of work, and education. So, you know, that's something that is really frustrating, I think, for all of us. So, and just to say, let's be honest about this. Basically, we are seeing community transmission in Wakefield of the Indian variant. It's completely to be expected. It's exactly what happened with the Kent variant, and we may get many variants after this. It's likely to become the dominant variant everywhere, and actually it's really infectious, and it's very, very difficult to completely control these things. And, you know, that's just how it is. And I think as community champions, and me as Director of Public Health, and other, you know, Colin as a sort of leader, clinical leader, really it's about being calm. We know that we know what we're doing. We've done this before. You know, this isn't something that is a particular concern. We just need to protect the vulnerable as much as we can, which is around vaccination, and, you know, support our communities as we always do. But really my biggest concern is, as I've said, is probably around disruption to education, employment, and what that means for families in the district. That's probably my biggest concern at the moment. And those things are out of our control. That's where we have national guidance that tell us what to do. And should we do questions? I haven't been looking at the chat, but if we do questions at the end, because we've got quite a lot to get through, I think, today.
Thank you, Anna. Yeah, so this is over to Colin. Thank you.
Hi everyone, so I'm Colin Spears. As Anna said, I'm a local GP and I'm a clinical lead for the vaccine programme in Wakefield. I just want to start by thanking you for the invitation to come and speak to you, but also thank you for the hard work that you're all doing in spreading the positive messages around the COVID vaccination programme, which has been an amazing success for our district. Next slide, please. This always feels like my JVT kind of moment, or Chris Whitty, where I get to say next slide endlessly. So currently, so we're now down to the stage where we're inviting people in from age 30 and above. That went down to age 30 this morning. And also, though, anybody that's older than 30 or falls into any of the priority groups. So the groups that would be younger than 30 are those that are clinically extremely vulnerable. Those were, I would say, that are high risk, but you can think of that as people that would usually receive their flu jab, and anybody that is a carer for somebody else and is you know, registered with the carer service, then would welcome those people to come forward. You can book directly with the National Booking Service without waiting, so you can just go online. But also there is the PCN or GP-led service who will invite you in by sending out text messages and other forms of communication. There's been some change to the vaccination programme, which I'll come to, but those that are aged 39 and below will be offered Pfizer and Moderna. We're not actually using Moderna in our district. That's only being used in one place in West Yorkshire. So we do have Pfizer available for anybody who's 39 and below, but also for any pregnant woman that wishes to receive a vaccination. And anybody that's over 40 will be offered whatever vaccine is available that day. You may have also heard that we're bringing forward second doses for cohorts 1 to 9, so that's everyone aged 50 and above, and also those clinically extremely vulnerable, carers, and kind of high-risk groups. And so we're going to be inviting them in from week 8 to week 12, and that'll be both through the local vaccine offer from PCNs, but also through the national offer through the community vaccination services. And this is really just as a response to the Indian variant, and you know, really ensuring that we maximise protection for everybody. You don't need to approach the NHS if your second dose is being brought forward. That will happen, and they will contact you. It just takes us a bit of time to work through inviting anybody in. If anybody has gone past 12 weeks, though, I would recommend either going online to the National Booking Service or getting in touch with your local GP, because we should be, you know, we're aiming to vaccinate everyone at around weeks 11 to 12. Just so a reminder of where the vaccines are being offered. So there's the community vaccination service in Navigation Walk Centre in Wakefield, and that is via the National Booking Service, so online. There's also some offered by Pharmacy to You in Morrison's car park on Dewsbury Road, but also the Pontefract Squash Club. And there's a new service that's opened at the Boots Pharmacy in the Ridings shopping centre. And then there is some local offer where you book via an invitation, which is usually done by text message from your GP, also through some phone calls. That's at Casford Civic Centre, King's Medical Centre in Normanton, St Swithin's in Eastmoor, Sandal Rugby Club, and Churchview Health Centre down in South Kirby. Our vaccination programme has seen significant success, and we delivered an awful lot of vaccines. So we're just over 200,000 actually now, with over 90% of people aged 40 and above having had at least one vaccine, and we've vaccinated about 40% of our population with 2 doses. So this data was published last week. Since then, things have moved on, of course. Really worth noticing that in cohorts 1 to 9, we're also seeing 5,000 people in the last week have come forward to have their first dose who hadn't previously come forward. So really heartening to see that the people are still coming forward to receive their first dose who had their initial offer of a vaccination probably in around January or February. So I just wanted to talk a little bit about variants and variants of concern, and really what's driving that. So I'm sure we all remember back to in high school being taught about, actually primary school these days, being talked about evolution and survival of the fittest. And the goal of all viruses is to infect somebody, which enables them to reproduce and move on. And in order to have the best success of that, survival of the fittest means that the strongest virus, the one that's best able to spread, but is able to infect somebody, but also without being fatal, is most likely to succeed. And so the more, I think of what's going on with variants is a bit like playing a game where the virus has to throw a 6 to win. The more games that are going on, the more chances to throw that 6, the more chance that there's going to be a mutation that goes on. So we need to get transmission and infection as low as possible to reduce the chances for the viruses to throw a 6 so they can mutate and become something else. But of course, a bit like we see every year with flu, where we have to give a vaccination because there's been some variation in the strain through mutation, we are going to see natural mutation occur within viruses because evolution says that that's what has to happen, survival of the fittest to occur. And actually what tends to happen with viruses is they become slightly more infectious but slightly less fatal, because that makes them the most successful they can be. So they cause less health problems but become slightly inconvenient. The problem is we're still very early on in the life of this virus, and it's not got to that stage where it is the equivalent of a common cold. Although common cold can lay the average man out for 2 weeks, can't it? And that's one of the reasons why we have to ensure that we get vaccine out as far as possible to as many people as possible, both to protect them but also to reduce the opportunity for the virus to mutate further. As part of this, it is very important that people do attend for their second dose of their vaccine, because that is the main way to offer maximal protection to everybody. So we know that the first dose gives a good level of protection, but the way to optimize that is through the second dose. And it's really clear that by allowing a good interval between doses and receiving that second dose, we can get to that 80 to 90% protection. And of course, there's some kind of recent studies that have come out that show that the vaccine is still effective against the Indian variant. So we're not seeing a loss of coverage there. If you haven't got your second dose, you can book it through the National Booking Service, or also through the GP service that's run at PCNs. PCNs tend not to book their second dose at the same time, and that's just because the way they receive vaccine was less predictable. So they will invite you separately for your first and second dose. It is ideal to go back to the same place where you got your first dose, but it is not essential. And in this case, it's just a case of getting doses where is convenient for you. So I believe there's some questions that came in advance, and one is about the safety of vaccines, which is a really important question, because the first thing that we get taught in when we study medicine is to first do no harm. And so the vaccines have been through quite extensive testing and approval by international bodies across the world that look at regulation and ensuring the safety. The other thing is that there's lots of surveillance that goes on after any medicine goes to the market. So the recent issue around clotting is because of that monitoring that goes on to make sure that we're not picking up any signals in the population of very rare events that we can see are starting to cluster and happen, so that we can put in place measures to mitigate and protect the population against that. And so that as this says, that the testing, actually, it says 20,000 there to receive the initial license, but actually we could probably think that these vaccines have been tested on millions of people at this stage, because the number of vaccines that have been delivered across the world. And of course, all of those regulators that exist in each country do talk to each other and share information to make sure that if a signal is being picked up in one place, other areas can start to see if they can see the same signal in the information that they are collecting themselves. In terms of side effects, so I would say, you know, half of us to 80% of us are going to get a side effect when we have our vaccine. Most commonly, that's a sore arm, or it can be a headache, feeling a little bit tired, lethargic, fever or chills. So when I had my vaccine, I got a sore arm the next day, and I felt a bit tired in the afternoon. When my wife had her vaccine, she had quite flu-like symptoms for 24 hours, took some paracetamol, you know, felt under the weather, but, you know, a day later had recovered. And for the majority of people, that's what will happen. You'll be able to cope. Paracetamol, ibuprofen is brilliant to help, and you'll experience them for 24 to 48 hours, and then life will return to normal. And that usually comes on in the first day or two after a vaccine. There are some more significant side effects that can come on, and they tend to come on a bit later, and that's, you know, after about 4 days. And that's generally around a persistent and severe headache that's not responded to painkillers, or, you know, swelling to an arm or leg, or severe pain in the belly, which, you know, we'd encourage you to seek urgent review. But actually, if you're ever concerned that your side effects are a problem and wanting to know what you should do about it, it's best to ask the question and seek help. So phoning 111 or going to 111 online is a great first place to look, because there's lots of information there. But if you phone 111, they'll be able to talk to you and understand what's going on and give you some advice as to whether that's a normal expected side effect that's going on for a normal period of time, or whether something needs to be done. Of course, you can also approach your GP should you choose to do so. Next slide. And I think the last point on that slide was really important, which is actually, you know, for this, the disease is worse than the cure. And so it is important that COVID is a serious illness, and that the vaccination is the best way to protect you. But, you know, the side effects aren't as bad as that. Just to talk about blood clots and the Oxford Astrozenica vaccine. So that this understandably caused a scare. It is a very rare condition, so it's somewhere around between 4 and 10 in a million people who've been vaccinated with the AstraZeneca vaccine will experience this. It is tends to only be seen after the first dose, and it is created by something that is probably a predisposition in that person to react to the vaccine in this way, that triggers a response where the body forms blood clots. There are slightly different to normal blood clots. So we've all probably know somebody that's had a blood clot in their arm or their leg or their lung. It's very different to those sorts of blood clots, and we see this occur with one other medication. It tends to be seen slightly more commonly in people under the age of 40, and that's why the change in the vaccine use has occurred. Of course, it can occur in any age, but tends to be in that age group. And we always have to balance the risk of a side effect against the risk of the condition. So we know that if you're younger and healthier, you are less likely to require hospitalization should you become infected with COVID and develop COVID symptoms than if you're older. And so, balancing that risk of serious illness against the risk of the side effects, and in this case, a rare side effect, tends to make it kind of more equal, lower down, than if you're older, where the risk of the side effect that we're talking about here, the blood clots from AstraZeneca, is much, much lower than the risk of being infected with COVID itself. And that risk is also part of that risk is based around how widespread COVID is circulating in the community. If you've got a higher chance of being infected, you've got a higher chance of being ill. And that's why we saw the age cutoff go from age 30 to 40, because the amount of COVID circulating in the community was much less. So that slightly alters the risk and the benefit equation that we have to think about. But as I said earlier on, if you do get side effects and you are worried, it is worth seeking advice and reassurance from a professional that can do that, such as a GP or 111. other thing to think about is if you've had your first dose of AstraZeneca, that we're not seeing any signs that people that have a second dose will then develop this rare side effect. So it seems to occur after the first side effect. And also, if you've had a previous clotting problem or a blood clot itself, it doesn't seem to increase your risk of developing this rare clotting problem. It's about a very unusual, probably genetic predisposition to form to react into the AstraZeneca vaccine in this way. So there's a group of people that may have had a drug called heparin, which is used to thin the blood, that will have had a very similar reaction to what we're seeing with AstraZeneca. And we think that the reason for it is probably linked. So at this stage, I'm happy to take any questions. I've not been monitoring the chat box, unfortunately, sorry.
I don't think there's any questions in the chat, but has anyone got any specific questions for Colin or me at this stage?
Can I just ask something?
Yeah.
Somebody told me they've got sticky blood condition. I don't know what that is, and they're saying they're not going to have the vaccine. Is that something that I'm trying to encourage them to speak to a GP, but I don't know just for myself what that means?
Yeah, so there's a range of conditions where people form blood clots more easily. So we call them thrombophilias, and there's ones called factor V Leiden and various other names because there's a number of them. That increases your risk of developing a normal clot. So I'm going to say a normal clot, like people get when they get a deep vein thrombosis or a blood clot in the leg or the lung. We don't believe, according to international and national experts in how the blood and clotting system work, their advice is that they don't believe that anybody that has a sticky blood condition is at risk from the AstraZeneca vaccine. There is a really, really small group of people that have had a drug called heparin, which we usually give to thin the blood, actually, and it causes this odd reaction where people form blood clots, and that led to lots of investigations, as you can imagine, because the opposite thing has occurred to what you were expecting, and that's what we see, and that's the only group that we currently say we would be cautious about. And of course, anybody that's had the AstraZeneca vaccine first time and developed a blood clot, but also they had low and abnormal platelets at the same time. So there are people that will have blood clots after they've had any of the vaccines, because people develop blood clots in the legs and the lungs quite commonly. It's unfortunately a relatively common condition. Those people that experience that are still okay to have the AstraZeneca vaccine as their second dose if the hospital who doing the testing didn't detect that there was an abnormality in their platelets at the same time. And the hospitals are all alert to this now, so they're doing those checks if somebody does develop a blood clot after having a vaccine. And this kind of funny sort of clot occurs between 4 days and around 4 weeks after having the vaccine. So for your friend, what I would say is, yes, speak to a GP who can provide advice. And sometimes when they're not able to answer, they actually end up getting in touch with me to reassure them that the advice that they're going to give is correct. But yes, your friend would be okay to have the AstraZeneca vaccine from the sound of things. However, their GP would know their specific condition and be able to give more tailored advice to them.
Thank you.
Thanks. And Colin, we've got a question from Alan Hudders that says they have one lady who suffers after the flu vaccine, so she's reluctant to have the COVID vaccine.
So I think that's a really, really sensible thing for people to think. I tend to turn it on its head and say, you've had a reaction to the vaccine which shows that your body's responding to the vaccine. So that's a really good indication that it's working. Doesn't mean if you don't get side effects, it's not working, but in some respects that could be reassuring. So we know that 80% of people will get an achy arm after the vaccine, and we know a half of people will feel mildly unwell the next day. But I would say to them, yes, you may react to the flu vaccine. You may not get a side effect to this vaccine, but it is more, the condition COVID is far worse than any of the side effects that we see. And I'd encourage them to have a conversation with someone about their concerns so we can explore them and try to reassure them as much as we can.
Thanks. And I think Sarah's just asked if Sadia's got a question.
Thank you very much. Sorry, I'm just writing on the chat box, but it's okay if I ask directly. So with AstraZeneca second dose, we know that if you don't have serious side effects like blood clots related to the vaccine, and you can have the second dose and you're being fine with the first dose. But I'm getting quite a bit of resistance getting the second dose, and they are still thinking with the media and too much knowledge about this low percentage of like a serious clot illness. And these are the people I know, even my close friends, they are not going for second vaccine because they're not being offered alternate vaccine, and they had the first dose of AstraZeneca and they are below 40. So are we thinking about giving them alternate vaccine, or should we leave them then?
So really good question, Sadia, thank you. So if you've had the first dose of AstraZeneca and you didn't get this abnormal clotting condition, we know that you're not going to get it if you receive your second dose. Based off the experience and the monitoring internationally of the use of the AstraZeneca vaccine. That's a really complicated, though, message to give to people, to say, there's this scary condition that could occur because you didn't have it the first time, we know you won't have it the second time. But that is unfortunately the scenario that we find ourselves in. The other thing is that the vaccine program doesn't really offer choice of vaccine type unless you're under 40, healthy and having your first dose. And that's mainly because there's, supply of vaccine is slightly unpredictable in some respects. So sometimes we don't quite know what we're going to have and be able to offer people. So we do lots of work to make sure that for the second dose, we're offering the same as the first. The biggest problem scientifically is we don't know what happens when you have the first dose of one vaccine and a second dose of another, and actually how much protection that gives you. We don't know if you get as much protection as if you had the two of the same vaccine, more protection or less. The fear is that you get less protection by having mixed dosing. There are a couple of circumstances where we will switch dose, and that is the vaccine type, and that is where it is impossible to get the same vaccine to you that you had the first time. That most commonly happens when you receive Pfizer vaccine at a vaccine centre and then become very ill and become housebound, and that's likely to be for a while. We can't use Pfizer in people's home just because it's a difficult vaccine to use when we're out and about going home to home, and so we have to use AstraZeneca then. But we're very aware of this risk, and we're waiting for the science to tell us what we should do, because there is always a possibility that we'll have to go back and offer some form of booster vaccine. It could be that the science actually tells us something different, and mixed vaccinations may be a good option in the future. But at the moment, that unknown level of protection makes us feel uncomfortable as to, are we doing something that's in the best interest of that person? Is that this injection that we're going to give them going to offer them the maximum protection that they can receive? And that's why your second vaccine should ideally be the same vaccine as you had first time, for that reason. Does that help, Sadia?
Thank you very much. I think there will be a few people, we will be losing them. I can't convince them to come for the second dose of AstraZeneca if they are under 40 with the increased fear. And the only thing they are asking us, giving the alternative vaccine, which is outside our guideline now. Yeah,
so unfortunately they can't be offered an alternative for their second dose. In fact, nobody can be offered an alternative for the second dose unless it's in extreme circumstances.
That's right. Yeah. Thank you very much.
Thank you.
And thank you, Sadia. We really appreciate you trying to get those messages out. And thank you so much for that. Because it is really hard, and I'm sure it must be really difficult telling people stuff where they're just turning around and saying, well, that, we don't want to do that. So we do really appreciate that. And hopefully over time, people may, change their mind. And we have seen that a lot, actually, people saying no, and then actually, if, a week or so later changing their mind. So I guess it is worth, if we can, just continuing to get that message out.
Yeah, it is, and it's an unusual message, because in medicine we say, if you've had a sensitivity to a medicine the first time, we'll try to avoid it the second time round. But with vaccination, we tend not to do that, and tend not to be able to do it because there's not a lot of options. And so unless you've got a true allergy, we're generally not able to switch to something different, and that's still the case with the COVID vaccination program as well.
Thanks. We've got a question from Karen, which is, my son is 19 and on the autistic spectrum. He has a diagnosis. He is really anxious about the virus. Is he eligible to have the vaccine?
So at the moment, there's a nuanced answer to this. At the moment, people that have autistic spectrum, diagnosis of autistic spectrum disorder, don't fall into one of the priority categories. However, my suspicion is that within the next couple of weeks, we will be offering him a vaccine. Because the pace at which we're going, so we're down to age 30, and I fully expect we'll be down to age 20 in the next fortnight, because that's that's going to be really important as we start to free up our society and our economy. So unfortunately at the moment we're not able to, because he doesn't fall into priority cohorts, and unfortunately they just had to draw a line somewhere where they, based on what they felt presented an increased risk of hospitalization. That's what all the risk factors were about. What is an individual's risk of getting COVID and being admitted to hospital, and requiring that level of care. And fortunately, autistic spectrum disorder doesn't increase an individual's risk of getting it. But of course, it's really sad, because I would like to give a vaccination to anybody that's worried and would like to have a vaccine. I wish we had enough in stock this week to do that for everybody, because I think that would be amazing. But unfortunately, we're having to pace who we offer the vaccine to based on age groups and other things around how much vaccine is available to us as more and more gets brought into the country.
So yeah, so I don't know when he's 20, maybe not in the next 2 weeks, but but obviously we're going, he will hopefully very, very soon he will be able to access the vaccine, and that will allay his fears, because we've got two spectrums, haven't we? People that we can't persuade to have it, and people that are absolutely desperate for it and can't have it. But obviously, as Colin says, very soon we should be able to get that.
And we'll be going down to age 18, and who knows what will be happening to the cohort, the group that are age 11 to 18. And just to answer, Jeanette, I can see has put a question, which is really simple. The take-home message is if you are okay with your first dose, you are and didn't get a blood clot, you are okay to have your second dose. That is perfectly safe. That's the simplest message. And actually, with AstraZeneca, your second dose, you get less side effects anyway.
So I think we've got a question on the slide deck. I mean, I suppose so the really interesting thing about why children and young people aren't being vaccinated automatically below 18 is because you don't normally do any sort of medical intervention unless there's a clear benefit for the cohort involved. And because children and young people haven't really had any negative outcome from COVID, that's why at the moment that's not a decision that's been made. However, for me, there is an argument about long COVID, because we are seeing rates of long COVID within potentially younger people as well. So that may just shift the balance, and then we may find that the national, because it's a national decision, not a local decision, that balance is shifted, and we do start seeing those vaccinations in that under 18 age group. Because it's with vaccination, it's always about balancing kind of benefit and harm, or benefit and risk. That's how it always is. So you don't vaccinate a cohort to particularly protect another cohort. You vaccinate a cohort to protect them. So it's well, if you're a public health geek like me, it's actually quite interesting, a lot of the thinking that goes on behind it. And obviously, because COVID is such a new virus, we are still learning. So therefore we may see that sort of vaccination program shifting even more over the next couple of months.
And of course, we face difficult moral conundrums on an international scale when we start to come to the under 18s, which someone asked me the question yesterday, and I found it quite arresting, actually. Where is the best place to put vaccine to get the greatest protection for humanity as opposed to a country? The question that's on the screen, so around AstraZeneca and its effectiveness against the Indian variants. So this question's right on the cutting edge of science, actually, because this is the paper just come out in the last couple of days that talks about this. So we know that the AstraZeneca vaccine is ever so slightly less effective against the Indian variants based off the data that we've got available so far, and this is constantly being reviewed. Currently, though, there is no the international, the experts that sit in Whitehall and various other places are not thinking that a booster vaccination is going to be specifically needed if you receive the AstraZeneca vaccine in response to the Indian variant. And of course, they're always monitoring all of the variants and how they react, but it actually takes quite a long time to see how responsive people are to a vaccine. And I would go back to a slide that Anna showed earlier, which was the Kirklees slide based on ages, so we could see in that there was a hotspot developing in younger age groups. But if you looked much higher up, you could see that the rates were still very, very low in the 70-year-olds plus, which is, you know, they're looking at numbers like that on a national level, and that's exactly what they're seeing, is that they're not seeing any signal of people that have received one vaccine and over the other being more at risk from the Indian variant so far. However, if that changes, then what will happen is people like me will be told that we need to organise a change in the programme, and we'll do what we have to do. And we've already done that twice so far as part of this programme. And you know, we get to go and have an exciting meeting with the great and the good who tell us what to do.
Great. So I think we're moving, unless
do you have any more questions first? And then people can always email questions to us, Anna, can't they, as usual, on our email address, which is ccc@wakefield.gov.uk anytime, and we will pass them on to the panel of experts and get back to you. With your permission, Anna and Colin, what I'd like to do next is, we've done a very quick survey monkey. All of the people on the call, most of them are signed up to our Community Champions scheme, which is a meeting every other week with just a half hour with Anna and sometimes a guest speaker to get some key messages to go out and share in the community. And then other members of this call come for monthly meetings, which are a little bit longer and usually more in detail. But all of you are actually doing the very same job of sharing information and being our champions, and we appreciate that. So going forward, some people have asked, please can we continue to meet with your Director of Public Health, because we really find that valuable. And Anna's already said on many occasions how valuable it is for us too to get information from you, what people are thinking on the ground and what issues are important to you.